welcome. Thank you to those who are watching this video on the replay. Hope you're having a wonderful day today. My name is Nurse Choma, founder of Choosing Nursing, and today I'm going to be talking to you about 6 main areas that you need to know, that you need to understand in order to really understand pharmacology. So if this is an area that you don't feel comfortable in or confident in, then you definitely want to watch this video today. So one of the areas a lot of people struggle with a lot when it comes to nursing, the NCLEX, I know I did personally for a while when I was in nursing school, is pharmacology. And I would say the thing about it is that pharm is the second highest category on the test. All right, it's number 2. So number 1 is management of care or coronary care, and then number 2 is pharmacology. Between both exams, whether it's the RN exam or the LPN exam, it's the second highest category. Which makes sense because honestly, when you work as a nurse, you're gonna have to give medications, right? I don't think there's any type of realm, or specialty where you're not going to have to give drugs. So and drugs is something that can be life altering. Drugs is something that can potentially affect the whether it's good or bad, the health of the patient. So this is the reason why it's such a predominant area for the test. So what I realized is that whether you're somebody, if you're a repeat test taker or maybe you're a first-time test taker, and depending on the level of education that you receive, you may not be familiar with what is the full spectrum of pharm. And also too, if you're an international student, the thing that you must understand is that nursing, the medications, the way the medications are given, what we do give, it's not the same in other countries as it is here. So it's like you have to spend some time, like I want to say, not learning new language, but yeah, in regards, kind of like learning a whole other, not just, okay, I need to know a bunch of content, but understanding the dynamics, understanding the environment, understanding the culture of nursing here. And so that's probably one of the biggest things, because a lot of people try to focus so much on the information or the facts, but the reason why it's not retaining is because they have not tied it to the whole picture. All right, so this is one of the things I want to really stress. So this is pretty much 6 main areas that you gotta be familiar with, that you have to understand in order to really master pharmacology. And if somebody could put this in the comments, I would appreciate it as usual. Okay, and some of this information you're gonna find in the free guide. All right, some of the information you'll find in the free guide when you download it. So number 1, the first one is drug administration. So what do I mean by this? So the thing about it, yes, you learn the name of the drug, right? Yes, you learn what the drug is for. Yes, you learn why we're giving the drug, right? But it goes beyond that. Now you need to understand, okay, not only how is it given, but how does it influence the patient I'm giving it to? Because so it's not just, okay, how do we give this drug, but then how does this influence who I'm giving this to? You got to think of the whole thing. So for example, if let's say I have a patient and the doctor ordered for me to give them a pill, all right? Let's say it's like an extended release pain medication, like Oxycontin IR or something like that. And so the patient does have a history of some type of chronic pain. And that's the way it was ordered to give by mouth, right? It's a pill. But upon assessment, though, my patient has an NG tube, right? My patient currently has an NG tube because he came in because he was throwing up, he was vomiting, and so we ended up putting an NG tube in order to decompress his stomach. So now he's not eating anything by mouth, but the doctor has ordered for me to give the patient Oxycontin XR. So because I understand the administration of the medication and how it influences my patient, I need to consult with the physician, because I cannot just give a pill. I can't give this extended release pill to the patient, because if it's an extended release XR, extended release medications, they're supposed to be taken by mouth and dissolve slowly in the stomach, right? So in this situation, I can't crush it either, right? I can't crush that, because maybe what it is that, so this is where you put the whole picture into it. Maybe what it is that the patient has like a history of fibromyalgia. Catch me on this part. So I'm painting a scenario to you. They have a history of fibromyalgia, and because they have that history, that's the reason why they take the Oxycontin XR. But now they came into the hospital because they were throwing up. They were having nausea and vomiting. So we had to end up putting an NG tube in. And we put the NG tube in order to decompress their stomach. So right now they're not eating anything. In fact, they're NPO. But because the patient has a history of fibromyalgia, that's the reason why they're on Oxycontin XR. So I need to consult with the doctor. Hey, I know the patient is normally on Oxycontin XR, but however, though, remember he's NPO, remember he has the NG tube in. So what are we going to do instead? We need to give him a different pain medication that can be crushed or that's already in liquid format. That's drug administration, where you don't just identify how it's given, but then how does this influence the patient I'm giving it to? Because what you're doing in that type of situation, you're looking at things from a case-to-case scenario. You're looking at the bigger picture. You're thinking more critically, right? So one of the biggest things is that you want to get really good at not just memorizing it, but also thinking, okay, well, what's the effect of me giving it this way? You know, like for example, I talked about this before. If I have a patient and let's say I'm giving them IV piggyback, right? And I'm giving them a drug like vancomycin, and it's IV piggyback. So if I'm just thinking as far as textbook, I'm thinking, okay, it's ordered every 8 hours or that's probably actually too much, honestly. But it's ordered every 12 hours, depending on the patient. And so we're getting the route says IV administration. But however, though, because I'm thinking like a nurse, right? I'm thinking critically. This patient has a history of, let's say, renal problems, right? Or this is an elderly patient, and they're there because of pneumonia, or they have some type of advanced infection, and that's why they're on the Vanco. So at some point, I'm going to be concerned because every 12 hours, I'm giving them this drug. Every 12 hours, I'm giving them this drug. And they may not be able to handle that amount of medication every 12 hours, which is why we do, peak and trough or Vanco levels. So you're not just thinking about how it's given, but how does this influence the patient? What's the effect of this? Right? That's how you look at drug administration. You see what I'm saying today? Does this kind of make a little bit of sense? Because one of the biggest things is that I want to challenge you to think, I want to challenge you not to just identify because here's what a lot of people do wrong. A lot of times when people are preparing for the exam, they get into the habit, or even taking the exam, they get into the habit of trying to recall what they memorized versus really identifying what the question is saying. Because it's not only that you have to just recall what you memorized, but then now you figure out, okay, where does that fit into the question, right? Where does that fit into the question? So it's important that you think about the bigger picture. You know what? Another good example could be, you have a patient who has AFib, and they have AFib, and they're taking Coumadin and everything. And so now, because they're on the Coumadin, you go into the room, right? And when you go into the room, you assess the patient. You see that they're eating breakfast, and you notice that the patient is eating let's say the patient's eating like some spinach and some oranges and some pancakes and some, and some maybe like a muffin, right? And the answer says, okay, continue to assess or continue to monitor. But because you know, wait a second, I understand that Coumadin patients, they need to avoid green leafy vegetables if they're on Coumadin. So that's a red flag to me. You got to look for the red flags. All right, you have to look for the red flags. And that comes with and that's honestly, one thing I want to say right now, that's probably one of the biggest things about the exam. The exam is trying to see if you identify the red flags. Right? It's trying to see, and it really wants to see, do you recognize that there's something wrong here? The point I'm making though is that some patients, so there are some patients that are more sensitive though to the medication because the medication is a very potent drug. So it's done for everybody. Everybody gets the peak and trough because the drug. But there are some patients though that are elderly or renal patients where we have to monitor them more closely. So maybe instead of it being every 12 hours that we give it, it's every 24 hours. There's some patients where we switched it from every 12 hours to every 24 hours because they cannot excrete it that quickly. So it depends on the patient. Okay, so that's the first one. That's number one. Number two is drug classifications and side effects. Technically that should be 7. That should be 2 thins. Not 1 thin actually. But I put it together though because in the end you got to know it together. All right, so anyways though, so one thing that's important when it comes to drug classification and side effects is it's important because you want to get good at grouping the drugs and identifying what the side effects of that drug, of that classification. For example, beta blockers is a classification. That's a drug classification. And the side effects that is always associated with beta blockers is bradycardia. That's an example of one right there. All right, so that's why I put it together. Now I remember why. That's why I put it together. So drug classifications and side effects together. So the thing about the exam is the exam can ask you questions where it will say, which of the following which of the following medications would contraindicate green leafy vegetables or contraindicate a patient who has low blood pressure or something, right? And so what it's going to sometimes do is that it's going to give you a bunch of classifications. Is it fluoroquinolones? Is it beta blockers? Is it tetracyclines? Is it going to be let's see, like amiodarone or inotropic agents, right? So you got to be able to identify the classification and then the side effects that matches that classification, because there's very specific side effects that goes with let me see if I look at my chart real fast. There's very specific side effects that goes with specific classification. Even for example with the beta blockers, not only can it cause bradycardia, but it potentially can also cause respiratory depression. Okay, it can also cause like respiratory depression as well in patients though who already have a risk for this. So for example, if let's say the patient has a history of like COPD or asthma, we're not going to ideally want to give it to them because they're more likely to experience these side effects. So being familiar with the classification and the side effect that always goes with that classification will help you a lot. It will help you a lot when it comes to the exam. We also know that, for example, nearly every type of antihypertensive drug, the side effects that always goes with that, for example, if we're looking at calcium channel blockers, side effects that always goes with that is going to be orthostatic hypotension and dizziness, right? So you got to get comfortable with being able to associate classifications and side effects.